Hello, and welcome to Revising Medicine. Today, I'll be discussing the symptoms of encopresis. The main symptoms of encopresis are soiled underpants, constipation with dry and hard stool, bowel movement avoidance, and irregular passage of large stool. Encopresis is a disease that only occurs in children, who are usually at least 4 years old. When it comes to bowel movement avoidance, this could be due to pain, and you may find that your child strains to hold stool in. Other symptoms of encopresis you could end up experiencing are abdominal pain, urinary tract infections, and you could have a lack of appetite. Abdominal pain and lack of appetite are usually caused due to the stool that is stuck inside the intestine. If the child continues to avoid passing their stool, they could end up stretching their colon. The best thing to do is to visit the doctor, since this can cause the child a lot of physical and emotional stress. You also want to regularly exercise, eat high-fiber foods, and drink plenty of water, because by doing these things, you are helping to soften your child's stool, which will make it much easier for the material to move through the intestines without giving the child any discomfort. Now, on to diagnosis. This is the most important part, as these are the methods you will learn to use on a patient once you're a doctor. A physical exam can be done, an abdominal or pelvic X-ray can be done, and a psychological evaluation can also be done. A thorough physical exam will be done to assess the health of the colon, the rectum, and the anus. The doctor might insert a gloved finger into the child's rectum to feel for dried or hard stool and to make sure the anal opening and rectum are of a normal size. This will also suggest whether the anal muscles are of the right strength too. The X-rays are done to check how much fecal matter is in the colon and to see whether the rectum and the colon are enlarged. A psychological evaluation may be done with the child to find out if there is an underlying cause for their encopresis. That's not the end. There are 2 other ways that encopresis can be diagnosed. A barium enema can be done, or an anorectal manometry can be done. Occasionally, the doctor will perform a barium enema, which is a special kind of X-ray. A tube will be inserted into the rectum, and slowly a radiopaque white dye called barium fills the colon. In case you didn't know, a radiopaque dye is a dye that is visible in X-rays. This is done to highlight any abnormalities in the colon, like twisting and kinking, that could be causing the encopresis symptoms. Lastly, anorectal manometry. This test is where a tube with pressure sensors is inserted into the rectum, and the child will be asked to push as if they are going to pass stool. Most children suffering from encopresis do not know which muscles to use and are uncoordinated when they try to eliminate waste from their rectum. This test is great because it allows the doctor to easily document any abnormal contractions the child uses when trying to defecate. To avoid making any mess, this test is only done when the rectum is completely empty. Thank you for watching. This was a brief look into encopresis. Remember, the intention of this video is only to assist you in your studies and not to give out actual medical advice. If you found this video helpful, please give me a like and subscribe, or share it with someone who you think would be interested. Leave a comment down below if there's anything else you'd be interested in learning about. See you next time!